Part two, going to the doctor. I did talk to another doctor, and it turns out we also, which is a good idea, make a list of what you want to talk to the doctor about, and when you go through the list, check it off. As far as other issues, if you're going in for an annual, that really depends on your age, what you get done. Women might get a pap smear, they might have a breast exam, they might have a colonoscopy scheduled depending on if you're 50 or older or have a family history. As part of a female annual exam, typically they might even do immunizations if needed, as well as get a mammogram scheduled. And depending on your age and your family history, you might get a bone density, which looks at fracture risk, and the diagnosis of osteoporosis, which essentially means not strong enough bones. Men, typically above 50, will be looking at maybe a prostate exam, blood work to include prostate, cholesterol. They as well might need immunizations, flu vaccine, etc. If it's been greater than 10 years, everybody should have a Tdap. That's tetanus and pertussis. And pertussis, of course, is the one that we prevent whooping cough with. Other things men could look at, depending, would be chest x-ray if they're a smoker, maybe. Sometimes if you're getting a full annual physical and you have hypertension, you might get an EKG, which is called an electrocardiogram, which measures the electrical tracings of your heart. And of course, annual blood work, similar for men and women, includes a complete blood count, which is called a CBC, that looks at your hemoglobin, which is your, in lay terms, iron level, your white blood cell count, which looks at infection, and your platelet count, which looks at your clotting cells. Probably a comprehensive metabolic profile, which looks at electrolytes, kidney function, liver function, protein. And then sometimes you'll get a hemoglobin A1C, which looks at diabetes. A lipid profile, which looks at total cholesterol, triglycerides, HDL, which is your good cholesterol, and LDL, which is your bad cholesterol. And then once you get that blood work, you can discuss that with your doctor. Another thing that I think is very helpful is if you know you're going to be getting all that blood work, you might want to have it done before you go to the doctor so that you can have it there. Even a woman who needs a mammogram, you could actually get it done ahead of time and then discuss the results at the visit, so it's a one-stop shop. As far as other things, then you want to make sure your medicine refills are done, and as well make sure that you get your lab work ordered, and then answer all your questions. Especially at an annual, you want to make sure that any of the questions you're having as far as concerns, and I even have people ask me stuff about their family, which I'll give insight to, but then I'll say, well, your family member needs to come to the doctor. Men need to go to the doctor. Women tend to go to the doctor quite a bit because of pregnancies as well as pap smears, but men need to go to the doctor too. What else? After your annual visit, you'll talk with the doctor about when you should come back. We all get our oil changed. We all get our tires rotated. But do we get our own oil changed? Do we go to the doctor? We say we can't afford it. We say we don't have time, but yet we figure out a way to get our oil changed because an engine is expensive. Well, what's more expensive, you or your engine? Just remember to take care of yourself. Get to your doctor. Utilize your doctor. Some doctors' visits don't go well, but for me, they didn't go well because I didn't ask the right questions and I wasn't prepared. So make sure you prepare ahead, even for your kid visits, and the visit will go much better. And then you'll feel empowered because you can direct the visit as opposed to the doctor or the healthcare provider directing the visit. So with that, I'll end. Again, Happy New Year. Remember drinking all your water. Remember trying to get your exercise. And continue to work on those things that you know you need to work on. And I'm out of here, and have a good day. Bye.